Video calls may have kept us close to friends and family as well as our colleagues, but 1 in 10 UK adults has become more self conscious about their look and their smile. In particular, 40% of men are more self conscious of their smile in social situations such as dates or video calls, in comparison to 30% of women. I speak as somebody with slightly wonky teeth who doesn't like seeing himself on Zoom. However, I cope. Somebody else who gives a few tips on how to get around this is president of the Oral Health Foundation, Dr. Ben Atkins. Good afternoon.
Good afternoon. How are you?
I'm good. I trust everything is going good with you.
It's always perfect, my world. Always perfect.
That's the way we like it. Now, we're in the midst of National Smile Month, which runs through until the 17th of June. And we often, maybe have regrets that we didn't look after our teeth quite as well as we should do. But there's normally something that your orthodontist can help with, isn't there?
I think there really is. During this wonderful Zoom advancement that we seem to have gone through over the past year, so the work done by the Oral Health Foundation and Invisalign have made such a behavioral change thing. You suddenly realize people are looking at their smiles so much more. Whether you didn't wear your brace properly when you were a kid, that's like me, having aligning treatments later on have become sort of the rage after. There's a massive, what we call a Zoom boom at the moment. I think linking that into this world we're in has made people more aware, especially if they're oral health. And if we can use our mouths to get a bit more control back into our life with the prevention, brushing your teeth twice a day with a fluoride toothpaste, visiting your dentist when you can, and reducing that sugary snacks, this awareness of our mouths could be a massive advantage coming out of COVID.
Absolutely. And I think the thing is, though, it's also seen a spike in weird online adverts for generic retainers and that sort of thing. And that is a concern, isn't it? We need to make sure we're steering away from buying things for our mouth, which need to be made specifically for us by post, and make sure we're buying the correct things through our dentist.
I think it's really important, especially after the General Dental Council statement recently outlining that you really you must see a dental professional to get treated for your teeth, because the damage people can do without seeing a professional can be catastrophic. It really can. And you only get one set of teeth in your life. My experience of working with patients who've been out of the country to get treatment done when we could go out of the country was amazing. The standards of the UK dentistry and orthodontics it's in the top league without a questions, because of the amount of regulation we have over this country, and it's something to celebrate, really. So really take into consideration, cheap things are usually cheap for a reason.
And yeah, it is about looking after that smile. And as you say, you get one set of teeth. I've got some gaps in mine at the moment, which I'm unfortunately still discussing with my dentist the way in which we fill the bits that we need to. They're not at the front, so it isn't too noticeable. But we can make mistakes throughout our life. I've enjoyed sugary snacks way too much, but it is about treating what we do have now well, and it's about not giving up on them, isn't it? As much as anything else.
It really is, because at whatever stage your teeth are at, you can get them to heal. You can get the decay to stop. You can get the gums to heal, and you can make them feel better. The key thing is visiting your dental practice, or just give them a phone call to see where we are within the journey of prevention. And it can make such a difference. This is one of the big advantages of this Zoom world we are in, is the fact that we can do oral hygiene discussion over the phone now, and it makes such a difference to my patients, working with them on their oral health before they come to see me, because in a week, 2 weeks, you can totally turn around your oral health, and that gives you better choices going forward.
So if somebody is thinking of maybe getting their teeth aligned, it is about that conversation, and it can take a little while to do, but actually it's worth it at the end of the day, isn't it?
Oh, it phenomenally is. When you get your teeth aligned, my personal experience is when I had all my bits and bobs taken off and it finished, I got all those smiles back that I'd been hiding my teeth for the years. And you can actually think about that when people are walking down the street with their mask on now, they might be smiling underneath there. And 9 times out of 10, I am, but people can't see that. And suddenly to give a patient their smile back, there's nothing better. There really isn't. They give the beam, their light. You can tell patients are happy with their smile. They start pruning, looking at their hair, their eyes. The mouth is such a communication tool with body language, walking through the door, giving patient confidence. We all need a little bit of confidence at the moment, and why not start with your smile?
But well-aligned teeth as well can avoid unnecessary wear because they will not be clashing in ways in which they shouldn't do. And it also means you can got a better chance of oral hygiene as well because the spacing is more likely to be right.
Yes, it's really, really, oral hygiene is critical. Brushing our teeth twice a day with a fluoride toothpaste, making sure you're stopping those snacks between meal times, and visiting us as frequently as possible. And straight teeth make such an easier, so they're easier patients to deal with afterwards.
That's the way to look at it as well. So if people want more information about what can be done and the way in which this is funded too, where do they go to?
For me, we have a website called dentalhealth.org. If they want more information about the safe way to straighten your teeth, look at safebrace.org, which is a website and a campaign we're working, the Oral Health Foundation is working with the British Orthodontics Society to have a safe brace. To understand education for patients is critical. And obviously there's the Invisalign website.
So you can check all the details there and see how you can get that smile to be even more beaming than ever by having the best teeth you can.
Fantastic. And remember, keep smiling.
Absolutely. Dr Ben Atkins, President of the Oral Health Foundation. Thank you for joining us.
Thank you.